Hello, everyone. I'm Solomay Tibabu, the host of Going Digital Behavioral Health Tech. We've got an excellent conversation ahead of us today with Highmark as well as RIA Health. Thanks so much, Demetrius and Tom, for joining us. It would be great to do some brief introductions. How about Demetrius first and then Tom next, please?
Yes. Hi, I'm Demetrius Marousas. I'm the Director of Behavioral Health for Highmark. And that makes me sort of day-to-day operationally responsible for utilization management functions and case management. And then with a strong interest in what our network is available to our membership.
And hi, everybody. My name is Tom Nix. I'm the CEO of RIA Health. We're a technology-enabled telehealth medical practice that treats alcohol use disorder as a center of excellence. And we do that by delivering a national program that includes evidence-based protocols such as medication-assisted treatment and coaching support and technology to support engagement.
Thanks so much. This is, of course, a very timely conversation given what's going on with substance use across the country. So thank you both. To set the stage, Demetrius, could you tell us a little bit about Highmark's alcohol use disorder or substance use disorder strategy broadly, including pain points over the last few years and why you implemented the strategy that you did?
Well, so alcohol use disorder has always been our number one spend. And I'm going to emphasize that's where we know it exists. The underlying piece is the piece that we don't know, the individuals that are struggling with alcohol use disorder. And sort of given the idea that it is our number one spend and we want our members in treatment, and we have an available network and we're looking to augment that. Now, in light of, everyone has made advances and has made sort of telemedicine and they sort of developed and some of it uneven. And what we found is that there's an opportunity with some providers who are native to the digital space and the telemedicine delivery of care that have really excelled in this. And so we saw that as an opportunity to sort of broaden what our members have access to. And then in the spirit of adding new providers, also, advancing our promotion of behavioral health needs and the access to all of our network, inclusive of our new providers that we've been adding.
Thanks so much. Can you tell us a little bit about what compelled you to choose the specific solutions that you did and how do they fit into Highmark's broader behavioral health strategy?
So the portions of the behavioral health strategy that I've had the opportunity to work on have been really around sort of network development and provider facing. And so, we were fortunate to be introduced to, several providers, RIA being one of those and an early one for us. And what was attractive of the providers that we ultimately have sort of selected to, contract with is that they were delivering evidence-based care, that they had a system that of care delivery that is supported by sort of psychoeducational content, synchronous, asynchronous points of contact for our membership. And they have a model of quality care delivery that we can have confidence that evidence-based practice is deliverable in a scalable way. There's some degree of comfort with that I would have to look closely at the rest of our network to understand that. And I would have to look at many providers many times to have that same degree of confidence, and having a sort of scalable entity that's delivering evidence-based practice in a way that I have confidence in is sort of one of the driving factors here.
And I know RIA has always been known for that evidence focus. And so that's another great vouch of confidence.
Yep.
Tom, now if I could turn to you, I know that you present RIA as a center of excellence for alcohol use disorder. Why not treat more substances?
Yeah, that's a great question and one that we encounter frequently. So the reason that we're focused on treating alcohol use disorder is there's a couple of factors. The first one is when you look at substance use disorder in general, about 70% of the people with an SUD will have a primary alcohol use disorder component. So it's the majority of the people with SUD. And then when we look at the last 40, 50 years of treatment for alcohol use disorder, what we have seen is the treatment rates have been, consistently in the single digits. And so we set out on a mission to focus on putting a program that would remove a lot of the barriers that people have towards taking steps to get help. Some of those barriers are time. Some of those barriers are money and distance. And so by speaking to people that are struggling with alcohol misuse on a very focused, narrow and deep approach, what we're seeing is that people are more receptive to a program like ours than in some cases a program that may treat multimodalities such as smoking cessation or stimulant abuse or opioid use disorder. And we did a recent survey that showed that about 68% of the people that were looking for help for themselves or for a family member would want to have a program that specialized in alcohol use disorder versus a one-size-fits-all treatment approach. So fundamentally, it's a big untreated problem that's gotten worse with the pandemic, and really meeting people where they are with a solution that's going to resonate with them. By having the narrow, deep approach, we're able to do that and remove some of the barriers and increase some of the opportunities for people to get help. And then lastly, for us, it's about the quality of the outcomes people have and being able to deliver that quality. It's for us, I think, a little bit challenging if you're treating multi-modality addictions to be good at everything. And so we want to be excellent at treating alcohol use disorder. And we've been able to do that for the past 5 years. And if you want to see some of our outcomes data, you can scan the QR code to do that.
Really helpful. Thanks so much. So now I want to dig in more into your partnership. Demetrius, if I could turn to you now, can you tell us about how Highmark structured your implementation, activation? What was that like for your organization? And perhaps maybe what learnings would you share with other organizations who are going through this process?
So, we certainly approached it. So, we contracted with RIA as a provider, adding them to our network. And we were also quite sensitive to, the sort of the so what. We added a provider that we were glad to have to our network, but then they can quietly sit on our network and wait till our membership finds them. So we also, are certainly motivated to promote, our members gaining access to care. And so part of that is also increasing their behavioral health literacy is sort of the language that we're using. And so we've combined this with campaigns that are member facing, as well as the rest of our network facing. So we've had educational campaigns, webinars, promotional materials that go to our primary care network to, sort of see something, say something. So if today you have somebody that may have, a problem with alcohol and they're not sure what to do, here's the opportunity. As simple as, linking them live to RIA as you're sitting there with them in the office and sort of looking to further promote that. Also identifying some opportunities to enhance how our network is presented to our membership. Our membership doesn't have the vocabulary we have as much as we would wish it. And so how do we tell somebody who's looking for something in a way that they can match their vocabulary with what we have available? So those have been some of the fundamentals. It's a slow process. It's made easier by having, good partners And RIA has certainly been a good partner here. We've trained our internal case management resources. We've trained some of our external health partner resources, health system partner resources. And we have some ideas to further expand and do more with that.
That's really exciting. Thanks so much. And Tom, maybe I'll ask you the same question from a provider perspective about learnings that you can share.
Yeah, well, first of all, I think we're really appreciative and grateful for Demetrius and his leadership and the team and support that the entire Highmark organization provided. When I looked at the experience that we had in implementing in essentially planning for that implementation, what stood out in our working with the Highmark team was the incredible buy-in across the organization and the coordination that Demetrius's team had with critical parts of the Highmark organization, whether it's the commercial team, the provider relationships that they had. And that was really one of the things that we found enabled the progress through the implementation and then activation. Demetrius said that it takes time, but in comparison to some of the other opportunities that we've had with other national payers, it was rapid and very impressive. And I think a lot of that had to do with some of the methods that they used and just really overall that executive sponsorship throughout the entire process. And so, from my perspective, I think it's incumbent upon providers that are, really for many health plans, these providers are desperately needed to increase accessibility. And so being able to work across the organization in a collaborative way to ensure that you have a successful implementation is critical, but it's really difficult to do without an executive sponsor at the helm. And so with Highmark, we had that, and that really made a big difference.
Absolutely. It's clear that both of your organizations are committed at all levels to address this huge problem. So it's great to see. Now, kind of moving forward into what's next, Demetrius, I'll go back to you. You've been a leader, not just at Highmark, but also throughout the Blue Cross Blue Shield Association. Where do you see behavioral health and strategic initiatives moving forward?
Well, I see the future being some of the data integration. So it's nice to have quality providers. It's nice to have a network with quality providers expand. And I think sort of decompartmentalizing the services. And along with that is destigmatizing. Now, in some states, there are going to be regulations that, and legislation that has compartmentalized these sort of data. But the fact that somebody's being treated for alcohol use or, misuse-related themes, that should be visible and immediately visible to primary care, just sort of like lab values are. Or somebody's risk factors if we're talking more psychiatric related themes or themes related to anxiety or depression. That everybody in that sort of healthcare delivery model surrounding that patient should have that. So I see that as the near future and the technical solutions that I think are sort of immediate interest. I think there are other sort of niche and sort of very specialty themes, and that's been part of our approach at this point right now. Looking at providers that do something unique that's evidence-based and to augment what we have in our network. And also taking the theme that not one thing will fit everyone. So we're not looking for these grand sort of universal solutions in the behavioral health space, but really to make sure that if somebody needs something, that at least there's a selection to choose from, and it hopefully fits that person. So RIA is likely to fit many, and if not, we have other solutions as well that maybe face-to-face, old traditional brick and mortar kind of providers may fit somebody more than someone else.
Absolutely. just broad and generic, not quite it, but more so specific solutions that are more personalized to the individuals and empowering their choice. That makes a lot of sense. And Tom, from a national provider perspective, what does the future look like for RIA Health?
Yeah, I mean, I think Demetrius touched on a lot of things. In when you think about some of the key things that he touched on in his last response, and the one previous to that, was the buy-in that his organization had around really educating a variety of different constituents. Those constituents being, across primary care, across providers that are within the Highmark network. And what we're seeing is, at a high level, many organizations are trying to implement a whole person health strategy and really marrying the physical health with the behavioral health. And it's an area that we've invested a lot of energy and time to work within a collaborative model. But what we're seeing, especially from some of the efforts that Highmark has done early on, is a lot of the referral flow from that education is coming to us, where patients are, screening in a higher risk way for alcohol misuse. But when we go back to whole person health, back to what Demetrius said, it starts with the data and being able to assess not just the person who's likely to be at risk, but also to assess the types of opportunities for what will work for that individual and what's going to be a way for that individual to become healthier, both physically and mentally, through different types of care options. There is no silver bullet for the things that we do in substance use disorder, but what's really critical at this stage is to have optionality on the table. And that's what we're doing today, is really speaking to that large group of people that are looking for a solution that's going to be specifically personalized to them. And so that's kind of our opportunity. But when we look at the future, it's really going to be coordinating the care with the physical health teams, working around some of the inherent challenges that are, kind of low hurdles with regards to CFR 42 Part 2. But, eventually, and I think everybody's goals are aligned on this, being in an environment where we're really providing a coordinated approach that's going to improve the health of an individual by helping them address their alcohol consumption, which will then in part maybe help, their liver health or their heart health. And so those are things that we're keenly focused on. And we see that as the future driving force for the opportunities that we're working on today. And, we're really grateful for that opportunity with Highmark.
That's a huge opportunity. Absolutely. I have so many more questions that I want to ask each of you. And I know we're running out of time. So if I could just ask one more of both of you, what else would you like to see others do to support substance use disorder treatment?
Well, I think the critical thing, if, as many voices as possible to reduce stigma, that, if somebody, has a need, and at the very least they want to validate, is it truly a need, that they have the comfort to put their hand up today and ask for that help. I think that's probably the most critical piece here. As broadly as we can, continue to reduce stigma, continue the dialogue. And I think if there's a positive, one of the positive things that came out of the pandemic is that more people are willing to talk about this. Whether it's stress, whether it's anxiety, whether it's depression, whether it's substance use. And as a result of that, hopefully we can get more people who need care into the right level of care that matches that need.
And I'll just add, I think Demetrius is spot on in regards to kind of reducing stigma when it comes to talking about this. And I think generationally, we're seeing people that are entering the workforce over the last 5 or 8 years. They have, much different perceptions around talking about mental health. And so I would add to that just the openness and willingness around using the communication channels people have, whether you're an employer, whether you're a health plan, whether you're a third-party support for an employer's population, using those channels to communicate the accessible options That's really, really critical, because it's kind of back to the presentation title, like, if you build it, they will come. It's one thing to have these great solutions available to people, but when you go through a navigation experience, there's a challenge. And that was really highlighted in the McKinsey study in 2021, where employers weren't prioritizing substance use disorder, but 85% of the employees that they had looking for help had a real challenge. And so communicating to your employees or your members about the options that have been implemented to improve the accessibility, those are things that I think would be really helpful, and they would build upon the opportunity to destigmatize, like Demetrius said, and make a big difference.
Thank you both so much for pointing out both of those topics. We've got not only employers, payers in the audience who can adopt that advice, Tom, but also individuals who are struggling right now. And so, Demetrius, I really appreciate what you said as well. It's really inspiring to see the amazing work that you two have done together. I know that both of your organizations are very focused on outcomes for this specific population that is quite large. So thank you for the work that you do and for sharing your partnership with us today.